Hey everyone, this is Dr. Martin with a special event. Tonight we're doing a little bit of a town hall. We'll see who's got time on an evening to do this. But this will be recorded, so it'll be live for a while. So you'll be able to look at this later if you're not able to make it tonight. So again, my name is Dr. Martin. I'm the one of the physicians at Einstein Peds, also the founder. Tonight, as a special event, I really want to focus on COVID-19, in particular the vaccine. So I am going to certainly open this up to questions. My hope is to have some discussion of your common questions and concerns that you'd like to bring up. But I do have a brief kind of presentation. I want to talk about some of the common things that have come up in relation to COVID-19, a little bit about testing, and a lot about vaccine. So on that note, I'm going to share my screen. Give me 1 second here. Technology will work. All right, so hopefully you all see this. Let me make sure we're sharing okay. Let's see if we can get this back up. I love technology. Sorry guys, bear with me for 1 second as we have technical difficulties. There it is. Okay, so, and I'm sorry, the date's a little wrong. I have updated some of the information on the slides, but I am again going to focus on COVID-19 vaccine, particularly with the emergency use authorization coming up for the 5 to 11 crew for the Pfizer vaccine. I will tell you October 26th is when the advisory committee that votes on it and passes it on to the FDA to make a final decision will be meeting. So we do expect if it goes through, it's going to be shortly after October 26th. So keep that date. And those are actually live sessions. I can forward you that. So you can actually listen in if you want. It is the same time that they will be releasing all the data to the public. But right now, I and other pediatricians don't have access to the data from the studies. So it's hard for me to talk about that. And I think that's important for you to know. I have to thank VDH for providing some of the slides. So I am using some of these slides that they've made up. I've made some modifications to a few and added a few. So we're going to talk a little bit about what's happening in Virginia. We're going to look at some metrics that I did update, how it's impacting children, COVID-19 that is, things that you need to know. I do want to talk about some vaccine myths that even yesterday on a consult I was asked, and then go over some frequently asked questions and really answer your questions. And the way we're going to do this, obviously you're not going to be on video with me, but in the comment section, if you actually ask questions in the comment, and you can do that at any point throughout this, it's there. I'll be able to read them and actually answer them as best I can. And I'm always a straightforward person. So there's going to be things, as much as I work in this space, if there's something I don't know the answer to, I will certainly reach out to my colleagues who may be more knowledgeable in that particular area. So another one of the things I did want to talk about before I kind of go into COVID-19 is about testing. And so just remind folks how things are working. We are doing testing in our office. For those who don't know, Fairfax County Public Schools has just kind of updated a form that goes home, and they are allowing in some situations for testing to be done remotely at home. I know LabCorp, you can actually go online to labcorp.com and actually can have a test sent to you. So if you need to have your child tested for one reason or another, maybe you're going somewhere and it's just a requirement, we are asking you, if possible, not to overburden our system, because we are doing a lot of testing and a lot of visits right now. And I'll keep pounding on this. It's going to be probably a month or two before we, at least, if not longer, where we're going to be able to uncork things. So every day we've got X number of visits, and we're always exceeding the number of requests for visits. So we can't meet the demand right now. And that's not just our practice. That's literally across the state happening. So if it's a test that you don't necessarily need us involved with, that you're going somewhere, they're requiring before a trip or a place that you're going, we do ask that you try to do that at either a community testing site or with LabCorp, where you do it for, I think it's 5 and up. You can do it that way. They'll send the test to you. Now, on the flip side, and this is more of the situations we're seeing, if your child's been exposed to COVID but isn't showing symptoms, a lot of times we get those calls right away. One, the Department of Health should be contacting you. I'm hoping that's within a day or two. I know that because they are short-staffed like everyone else and there's not enough of them, it does sometimes take longer. But we generally are not going to recommend that you get tested for the first 5 or 7 days. And that's because these tests, particularly the antigen test, requires virus to be present in an adequate quantity, and it takes a few days for that to occur. So if you do it too soon, you're very likely to get a false negative. And so we do want to wait until 5 or 7 days following your exposure. Now, having said that, your child becomes symptomatic, so the immune system is starting to respond. There's got to be enough virus there that probably we would be able to test at that point. If your child has a mild illness, same thing. You're concerned they may have COVID-19, just call ahead for testing. If your child is sick and you can't get an appointment with primary care, meaning us, on one of those days, generally we're going to try to get you in same day, but there's some days where, especially late in the afternoon or evening, we can't get you in. We usually refer you to PM Pediatrics urgent care or one of the Inova urgent cares. And the last thing, more serious things where there's, and it's not fever, it's really the breathing where kids can get into trouble. And this goes with other respiratory viruses. If they're breathing very rapidly, for a baby that's 60, it can be 40 to 60 breaths a minute. For older kids, it can be 20 to 30 breaths a minute or higher. You may see them retracting between the ribs. Those are reasons we're going to actually probably push you to the emergency room. All right, so what's happening in Virginia, and I did update this today. And so this is the latest data from the Virginia Department of Health. I also tried to do this for our region. Let me make sure. Yeah, so this is our Northern Virginia region. And so you are starting to see rates, the 7-day moving average of a number of cases by date of symptom onset coming down. That's a good thing. And so it means we're doing what we should be doing, and I think it's a reflection of what's being done in the schools in terms of mitigation really working as well. The other thing I think we can be proud of, you'll notice 2 orange areas on this state. Everything else is red. Red means high transmission. Orange is the next level down, which is substantial. So it's not to be taken lightly, but it means we've moved out of high transmission in Fairfax down to substantial, which is the next level down. So we're ahead of everyone else, at least in controlling right now, with the rate continuing to go down. This data is going to be a little bit old. This is from the AAP, but I think it really does still sort of reflect rate-wise. So kids are making up, and you probably heard this in the news, kids are definitely making up a much larger proportion of cases. About 14.5% of all COVID-19 cases are reported nationally or in children. That's a lot of cases. And I think that's one of the reasons that even at Inova and a lot of the children's hospitals, you're seeing them overfilled, is just the sheer number of kids actually getting the virus this time around. And unfortunately, as you probably heard in the news, the hospitalization, the hospitalized patients that we're seeing largely are unvaccinated. And so unfortunately, the kids under 12 are unvaccinated. And so we are seeing a greater proportion of kids, and this means we're just overall seeing more severe cases in kids. Is the Delta variant seemingly being more aggressive in terms of the disease itself? No, it's just more infectious and there's more kids getting it. And so we are seeing more in the hospital. One of the things that people ask is like, well, is this really affecting kids? It's really not that bad. It's like a common cold. And that's true in some cases. But with the sheer number and effectivity of this, we have started to see a lot more serious cases. And the other, I will tell you, the impact that we're seeing is there's some kids who are having prolonged symptoms, even though they were mild. And we talk about the concern of myocarditis with the vaccine. There are definitely kids who are getting myocarditis in much larger numbers with the disease itself that have to be followed. And so there's a lot of things here that we're still piecing away. We won't know for some time with the disease and neurodevelopmental issues that we're seeing in the younger kids. And so while they may look like mild colds, this virus is an aggressive virus in many ways. And so we're going to have to continue to watch what happens to these kids. So it's just better if you don't have your kids get it. And so we want to do everything we can to do that and prevent it. Also keep in mind, and we're being reminded right now, there's a number of other viruses in the community: RSV, parainfluenza, rhinovirus. And these are spreading not just to kids, they're spreading out to the community. And it's just a potent reminder that kids, we love them, but they are a spreader of disease. They spread it to families, and it really spreads out from there. And so if we don't control COVID-19 in children, it's going to be very difficult to really eradicate or really control this disease in our population at large. All right, 5 things that you should know with the vaccine. And I will say I have no hesitancy in telling you that the benefits of vaccination, and all the kids that we've had get it, the 12 up crew, relatively pretty mild side effects. Those far outweigh the serious stuff we've seen even in our patients with COVID. So one, with any vaccine, I sometimes get asked, can you get the disease from the vaccine? And this goes for flu. All those people out there, it's like, I got the flu, and then I got the flu vaccine, and I got the flu from it, or I got sick from it. Not possible. Neither of these vaccines are live viral vaccines. Live viral vaccines can actually give you symptoms. So you get a chickenpox vaccine, you can actually get some mild chickenpox disease from it. These vaccines that we're using, and particularly the Pfizer, is an mRNA vaccine. It's not living material. It can't come to life. It can't give you COVID. You can have side effects from the immune response, right? And that's the fever and stuff that you experience, but you cannot get COVID-19 from the vaccine. Number 2, vaccines were made following FDA standards. I don't want to go over this a million times. I feel like I say this a lot, and you've heard it a lot in the press. The process for FDA approval, while accelerated in the time course, each of the steps are the same that we have always conducted in terms of the pieces that make that particular step what it is. The difference is many of these steps we overlapped, but the actual time and the process is the same as we would do with any vaccine trial. So normally a vaccine trial, like vaccine trials, will stretch over years. And many of the first stages of a vaccine trial, they don't move on from there because it's a huge investment of dollars. And if it's not looking promising, they just stop. In this case, we had many vaccines that you haven't even heard about that didn't make it very far, but we actually put all the money into all these different studies, and started different steps at the same time and overlap them in order to get it done more quickly. But it's still the same process that we would have followed. It's just a lot more expensive. And the government paid that, and that was a good move. COVID-19 vaccines protect your health. That's important to know. I mean, it really, these work. And now we have millions of people who have gotten particularly the Pfizer vaccine, but also the Moderna and Johnson & Johnson vaccine. We've got lots and lots of data. We're still collecting it, but there's no doubt that these are actually working. And you just have to ask anyone who works in the hospitals taking care of really sick patients, because most of those patients are not vaccinated. And the other nice thing, and I don't know if this is totally true, the vaccines are zero cost out of your pocket, but that's not exactly true because you pay taxes and you paid for this. This is government money that goes to it, but you're not going to have to pay when you get the vaccine. Vaccinated kids may have fewer restrictions. That's an important, and for me, as I work with schools on quarantining and the problems with quarantining, there's an easy way to step out of that vicious cycle of being quarantined, and that's getting vaccinated. And so in Fairfax County, if you are vaccinated, why they put a class on pause, those who are vaccinated are allowed to go back without quarantine. They will be tested, but they won't need to do a 14-day quarantine. And 5 common COVID-19 vaccine myths. So I just got this yesterday, so it's still floating out there, and it's about fertility, that the COVID vaccine will affect fertility. There is absolutely no data to support that claim. And more than that, there's really not a biological plausible explanation of how that mechanism would even work with the mRNA vaccine. COVID-19 can make children sick, and they should get the vaccine to protect themselves. So COVID-19 can make children sick. Sorry, I said that wrong. So COVID-19 can make children sick is absolutely true. And while the rate of kids getting as sick as adults is lower, you get enough kids sick you're going to have some serious effects on some of those kids. I think of chickenpox this way. Many of you grew up with chickenpox. I did. I had it. It was miserable. I still remember it. But most of us did okay with it. But it was such an infectious disease that even though it was less than 10% that had, more serious side effects, and even less than 1% who had things like encephalitis or meningitis or infection of the brain and spinal column. The reality is when you have millions, hundreds of thousands, millions of kids getting that virus, you're going to have thousands of kids actually having serious effects from it. And so by vaccinating, we were able to really reduce and eliminate that possibility. So COVID-19, I think a vaccine, think of it that way. And I think this last run with Delta really brought that point home with the number of hospitalized kids. With so many kids getting sick from it, vaccination definitely makes sense in a risk-benefit ratio. The vaccines will not alter the DNA or alter the DNA of anyone. This is an mRNA vaccine. So mRNA is sort of the way I think of it, it's almost like a template that the body works off of to produce protein. It's not your genetic material. It really is just a mold that the DNA programs to be made so that you can keep building the same proteins over and over. And so it's not DNA. It's not going to incorporate itself into DNA. There's no way for it to do that. And one of the challenges with mRNA vaccines was really getting them stable. And that's been for a long time. This technology's been out there for a while and it's been used in oncology. It's the first time we've used it in vaccines, but we have used it. But the really big challenge that had to be overcome was the stability of it. And Moderna and Pfizer were able to do that. So no one will become more vulnerable to or contract COVID-19 due to the vaccine. And I'll take that a step further. And what I think is interesting, we've seen with some of these variants, is that the vaccine actually outperforms natural immunity. And that's not always the case. So chickenpox I brought up, and natural chickenpox immunity is actually a little bit, it is stronger than the vaccine. But you have to go through disease and take that risk. That's not actually always been the case with the variants. Some variants, actually, the Pfizer vaccine outperform natural immunity. So it's interesting. COVID-19 does behave differently than other viruses in that respect. And so the vaccine actually has performed quite well. And the last one's not vaccinating my child will affect other children, not only my child's health. And I think that's one of the things I think is important. It really changes the dynamic if only a proportion of folks get the vaccine, whether it's adults or kids. And we're seeing that with these hot pockets of disease and where parts of the country are more affected than others. It really is important that we get the vaccine rates up pretty high to have herd immunity. We're not there yet. And I think it's one of these things where people perceive that the risk is greater of getting the vaccine than actually getting the disease. I think you also have to think the long term, like if you're going to be exposed to this virus over and over and over again, that may not be the case. All right, I'm going to stop sharing for a minute. And I do want to see. Good. So I'm going to actually open up a little bit to questions if you have. I do have some that I've been asked, and I'll kind of put these in. But the best way to do this, if you guys can drop questions in the chat section. And I'm going to say most things aren't off limits, so you're welcome to do that. Give me 1 second as I organize myself. Oh, there we go. Okay, got it. So some of the questions I do get asked, and so again, I'm going to stress, I don't know the data from the 5 to 11. That won't be released until October 26th to the public. I will say, I'm going to give you the stuff that I know people from clinical sites that I've heard from. And when you're on a clinical site, you basically, anything that happens to anyone, they get hit by a car and they have to go to the hospital. Anytime they're engaging the medical system, those get reported, and you as a principal investigator at a site will receive that information, because you have an ethical responsibility. If you have concerns about the product that you're giving, you have a right to stop the study or broach that up the chain and question that. And I think that's really, really important with these studies. And so from those folks that have been on, what they've shared with me is that there hasn't been anything that's blipped higher than in other trials in kids. And the nice thing about this with the new vaccine, it is a lower dose. Kids seem to be much more immunogenic and don't need as much. And you've seen that with other things, right? So when we give a tetanus to kids, what we formulate for younger kids is different than older kids. The HPV vaccine, we actually give fewer doses if you're under the age of 15 than if you're over. So the younger you get, the more robust often the response is. And so sometimes we just need lower doses. It's part of the reason we do these studies. Side effects from vaccine look to be pretty similar. So 12 up, I can tell you, the usual stuff we describe to people. Once you have that vaccine gets into your system, it does trigger an immune response with all of its usual side effects. So it releases things called cytokines and chemokines and prostaglandin E. Prostaglandin E lowers actually increases your body temperature in the hopes of slowing down whatever invading organism. Well, it doesn't know this is not an invading organism, so it's part of that response. So you may develop some fever after the vaccine. It's actually pretty common. Achiness and headache, I always tell everyone, again, that's part of all those chemicals that get released that make you feel that way. Again, if you think of it from an immunological point of view, the body wants you to conserve energy to fight off whatever it is. And so it's tiring you out, making you sit down and rest and conserve calories for the fighting of the infection. Vaccine does the same thing. That's the genius of vaccines, is that it's really trying to imitate the disease, boost that response, just like it with natural disease, without all the other potential side effects of actually getting the disease. And so those are the common things. Soreness, some lymph nodes has been a really common one. Some people will get actually enlarged lymph nodes. They may feel either under the arms or in the neck, may have enlarged lymph nodes that are tender to touch. And certainly I always tell people, if you have something excessively large or something, we can take a look at. But I've seen a couple of those where kids came in with those, and you just watch it, and they do go away over time. Fatigue has probably been a big one. I can tell you I had that, and I think a lot of people have had that, and that can last a day or two as well. Those are the big ones. The myocarditis is probably the other one that people are certainly watching very closely. It does seem to be, and even I don't know if you saw that there's a story about the Moderna being held in one of the other countries that was giving Moderna, and they're actually holding it in males, I think in their teens to 20s, because they saw a blip with an increase in myocarditis in that population, and they're going to hold on December and really analyze the data. So you're even seeing in the other mRNA vaccine that issue that we saw with Pfizer. I think the risk balance, the risk benefit, you have to weigh with this, because it's such a small percentage, and we're actually seeing more kids that get the disease get myocarditis, and most of those cases of myocarditis were actually quite mild. And I don't want to be dismissive of it. I still think it's something we have to really, really pay attention to, and we got to be digging into the data on the younger kids with, and they will be. And we have to, even if it does get approval, we have to continue to watch and monitor for. But it really does look to be a small effect. And it's probably a similar mechanism, I wouldn't be surprised to see, because the natural disease that triggers this sort of autoimmune response, it is not unthinkable that the vaccine in trying to induce a similar immune response might have that side effect, but it does seem to be significantly less with the vaccine. I know when this kind of broke the news, a lot of those kids were hospitalized for precaution, but most of them probably didn't need to be. And so the other thing I will tell you about myocarditis, it's something we do see with other viruses, like the virus Coxsackie that causes hand, foot, mouth. I've seen a number of kids in my career that have developed myocarditis from this. So this is not unique to COVID-19. I'm going to remind folks, everyone's quiet out there. If you have questions, I'm happy to answer them. Just drop them into the comment section. And I still get asked this. So what ages are allowed to get vaccinated at this point? So approval at this point has been 12 and over. And I think this is one of the things people have kind of, like, my kid's 11 and a half, or they weigh as much as a 12-year-old. We do encourage you to wait until the approval comes, and you're really close to the finish line with the 5 to 11-year-olds. But I'm going to say the same thing with a 4.5-year-old. If this gets approval, I would still wait until you have that data. Particularly the younger you go, the dosing may be different, and you really want to know what the dosing is. And that's what happened with this, right? So you had 11-year-old, they're actually going to get a different dose than the 12-year-olds. But again, right now, EAU is for 12 plus. We're hoping, and I think vibes are good that we're going to have approval by Halloween for the 5 to 11 if everything holds. One question I'm getting asked a lot: can you give COVID-19 vaccine with other vaccines? How far apart does the COVID-19 vaccine need to be in relation to other vaccines if they're given? There does not need to be any spacing between the COVID-19 and the flu vaccine, for example, which is what we're giving to a lot of kids right now. So you can give it on the same day. You could give them 2 days apart. Spacing doesn't matter. And this really has to do largely with inactivated, not living vaccines versus live viral vaccines. Live viral vaccines like chickenpox and measles, mumps, rubella, the spacing becomes really important, and they can counteract each other if not given together. So that's a large part of the reason. And so the ACIP, who's this group that comes up with the vaccine schedule, as well as the CDC, have kind of weighed in on that. So questions: what are you doing to treat myocarditis in the 12+ group who have gotten it as a side effect of the vaccine? So treatment of myocarditis varies. If it's mild, that may just be observation. They're measuring cardiac function and making sure the heart muscle is doing okay. It can be steroids and immunosuppressives to kind of counteract the inflammatory cascade. So there are, and so that, I guess that's actually a really important part. It's not like it's not treatable. So if you do have more severe cases, there are things that we can do in those rare cases. There are treatments. We've treated this before. It's not an unknown entity. And so that's what we do for it. Do you know when under 5 will be approved? Nope. But I do know the general schedule that Pfizer seems to be following in terms of the schedule of when they're going to be asking for emergency use authorization. And it really is month by month. So they predicted many months ago that they would be, because of where the studies were, and the studies were proceeding without a hitch. They expected September was going to be the month they were going to request EAU for the 5 to 11. They predicted Late October would be for the next group, which is 2 to 5. And then the following month, they expected the 6 months to 2 years. So far they're on schedule for that. And you do have to remember that means they ask for EAU, and then you have this pause where the FDA group, the advisory committee, has to, review these reams and reams of data and talk and weigh it, and then have an official kind of session and discuss and vote. Next question. Thank you for questions, because I was going to run out of things. Should unvaccinated children be around vaccinated relatives who are around other people attending public events? This is tough. And I think one of the things that's tough about this, and I've talked to people about planning travel and things, is it's a dynamic situation. And I've already showed you our data. I'm hopeful in the next month to 2 months, regardless of vaccinating kids, we're seeing sort of a decline in COVID cases. And so, that changes your risk benefit, your risk that you're going to places and doing things if the transmission, the amount of cases and transmissibility changes. And so, this is a hard one. I think part of it's a personal decision. I think it can be done safely. So, and it depends on what those vaccinated relatives are doing. So there's definitely breakthrough disease. We know that. And that's why we kind of gone back to wearing masks, even if you're vaccinated. I think right now I would continue to advise that. So, within your close household now, I'm not wearing mask in my house with my kids, but I do wear masks pretty much everywhere else, even if other people are vaccinated, my friends and whatnot. Outside, I'll make exceptions, but inside it's non-negotiable. And we're always wearing a mask. So, I would say with vaccinated relatives, you're outside in a well-aerated area. I think it's reasonable that they can be around. If they're indoors, I would ask the vaccinated folks, relatives, to probably wear masks. And I think that's a reasonable thing. But it really depends on the environment too. I think it's just how close together are you ram-packed in a building. I'm not sure I would bring my kids there if there's a lot of people in an indoor area. I think as a trend, and that's where I think that changes, like it did in June, where we were seeing very little COVID in the community. Right now, there's a lot of cases. We're getting usually positives every day in our office, so it's still pretty prominent out there. All right, let me make sure I think I got everyone's questions here. And I'm going to kind of come to a close. I just want to make sure I don't have anything else that people have asked in advance. This is probably the most important thing, right? Where can I get vaccinated? So there is, if you do vaccinate.virginia.gov, that will show you sites, and that's for anyone who's in the EAU group, 12 plus, right? It's pretty easy. You can walk into pharmacies right now. So if you do the vaccinate.virginia.gov, you can see where all those sites are. In terms of 5 to 12, in this area, there was an announcement. They are reopening a mass vaccine site in Tyson's. I think it's the Lord and Taylor's at Tyson's. So I'm happy to have heard of that. And I know we've been advocating that from the pediatric community. There are some other potential sites to a much smaller scale being looked at. And I don't want to say anything until I know everything. It's dotted and the T's are crossed. But I think you're going to see a few more community sites that are going to be able to vaccinate kids 5 to 12. So you're going to have to stay tuned. I will definitely keep you up once I know that. We'll do that. So the question comes up about Einstein Peds, and I feel terrible. I keep repeating the same message. Right now, we are sort of like on overload with patients. We're trying to get, with the amount of respiratory viruses, RSV, parainfluenza, rhinovirus, now flu, and COVID, and the number of tests that we have to do on all these kids, we are overwhelmed with the amount of patients that need to be seen. And we're still trying to do checkups. And so we just don't have capacity right now to give COVID-19 a vaccine out to kids, because it really does take some coordination and time and staff time. And I will say, in polling pediatricians around the state, about 50% are indicating they're not even in a place where they feel they would be able to give the vaccine. I hope that changes, and it's the same for us. I think this is so important. I want to be able to give it. But I think just with the number of phone calls and the logistics and the time it's going to take for us to, give it to the number of kids who need it, we just don't have that capacity right now. I'm hoping that's going to change. I actually spoke to Leanne today about that. We're going to get things prepped to do it, but until things loosen up with testing, I don't think we can do both things. And that's just the reality. And I don't want that to discourage you from getting it. It's not a statement by us that you shouldn't get it. We think you should get it as quickly as possible for your 5 to 12-year-olds, pending the safety data coming. I have to put that caveat up. And also, I'll probably do at least one more live thing before then as well, to kind of give you updates on all of this, as we know about sites, we know about some safety stuff getting released, and then we'll keep you posted, and keep looking on our Facebook. We'll be doing it there as well, and getting the information out to you. All right. One more question I missed. I'm sorry about that. What are your thoughts on unvaccinated younger kids playing together outside? You're asking the hard questions. So I've been really proud of my daughter. So she's a kid who really struggles with sensory stuff, but the one thing she could do is a mask. Once she got used to it, she wears it everywhere. And half the time she wears it inside of my house. Kids are really good with the mask. There aren't negatives to the mask. There really, really aren't. I've heard all kinds of stuff come from families about why it's harmful to kids. None of it's been proven true. I've seen anything bad come of it in all the patients we have. I think I would recommend having the kids wear masks if they're playing in close quarters. Outside, it depends on the activity. If they're playing, I don't know, hitting tennis balls across the net, no, you don't need to. But if you're going to do something, you're in really close quarters, even if it's outside, I just don't see the harm in wearing the mask, at least for the short term. And I will say, sports has been one of the problem areas for us with spread in kids. It was like that, 6 months ago. It was again when schools opened. Sports really presented a challenge. It's one of the reasons Fairfax County decided to make it, require it for sports, because they were just struggling with that aspect of controlling spread. So that would be my advice. There's not a mandate to do that, but certainly I think it's for a short time. I think it's a reasonable course of action. Great. All right, guys. Well, I appreciate it. I still have work to do. I still have notes to do from today, so I got to get to that. And maybe I'll say hi to my kids too. I really appreciate you making the time to be here, ask questions. It makes it more fun for me. I will definitely do at least one more of these before COVID-19 gets voted on for EAU, which hopefully it will, and to give you an opportunity to ask questions. I'll be checking this as well. So if you watch this later and have some questions that you want to put in the comment section, I am absolutely happy to answer them there as well. All right, guys, have a good night. And until next time, I'll see you later. Be well.